Gentlemen, if you've got pelvic pain and your low back looks like this, you might be placing unnecessary stress on your pelvic floor. This position is what is called an anterior pelvic tilt, and it might just be the thing that's driving your pelvic burning, aching, or maybe even some erectile or urinary changes. I'm Genital Swope, a men's pelvic floor physiotherapist, and today we're going to go over the 3 most simple exercises that anyone can do. They'll work to improve the posture of your pelvis, and it may just be the thing that finally gets rid of your pelvic pain for good. Picture this. An anterior pelvic tilt is this position where your pelvis rotates forwards and it causes an arch in your low back during posture at rest. Studies show that having an anterior pelvic tilt is more common in people with low back pain, as this pelvic position increases the lordosis, or the extended curvature in the lumbar spine. Here is where it ties into your pelvic floor function. This spinal position is relevant when it can compress the nerves and tissues around the pelvis, causing extra pressure on that pudendal nerve, located at the spinal nerve roots of S2, 3, and 4. Extra lordosis can ramp up pressure on pelvic structures, setting off these pain signals. Research shows that low back pain often triggers pelvic floor overactivity as your body guards the area. This is a concept known as pelvic-lumbar co-contraction. The pelvic floor and lumbar muscles co-contract for stability, so when your low back braces in pain, the pelvic floor can join in, creating tension that may eventually feel like this deep pelvic ache, or you may gradually develop erectile or urinary issues. Clinical evidence highlights this bidirectional pull. Tight pelvic floor refers pain to the low back, while back guarding hikes pelvic floor tone via the shared nerves and attachments at the tailbone. As mentioned, the pudendal nerve is a nerve that exits out of that S2, 3, 4 column, and if the muscles of the low back are chronically compressed, this is how we start to develop pelvic tension. There are 3 branches of the pudendal nerve that travel towards the penis, the anus, and the perineum. If any one of these are compressed, or we have nerve root compression at the spine itself, it can lead to all kinds of unwanted numbness, aching, burning, and this is what we call pudendal neuralgia. Studies confirm this high overlap. Many with chronic low back pain have pelvic floor dysfunction, with overactivity amplifying signals in a vicious cycle. So if we go back to that anterior pelvic tilt posture, what commonly happens at the muscular level is that the hip flexors at the front become short and tight, and so do the lumbar erectors at the back. The abdominals and glutes become less active and suboptimally positioned to produce force optimally, becoming what's called inhibited. So how do we fix this? Exercise 1 involves recruiting your abdominals. Specifically, we want to be able to feel the abdominals during a knee tuck or any exercise that emphasizes a posterior tilt. Lie on your back and use a dowel or a rolled towel between your knees and then squeeze. This will allow you to recruit your hamstrings, which will reciprocally inhibit your hip flexors. Then, visualize the movement coming from your pelvis as you perform a knee tuck. Generally, perform until failure for 3 sets or until you feel like you have lost the activation in the lower abdominals. If this exercise isn't working for you, you can always try to load the abdomen from the top down instead of the bottom up. Use a strong band and strap it behind your ankles. Ensure that you fixate it on a surface that's not going to snap or hit you in the head. Again, this will work in the same idea to inhibit the overactive hip flexors, and it will help you generate force in the low abdomen on a curl up. Keep in mind, you're still wanting to posteriorly tilt your pelvis, or in other words, flatten your low back to the ground while you do the curl up. Same idea, perform for 3 sets until failure. Keep in mind that if either of these exercises causes pain in the low back, you might need to find an easier exercise or spend some time trying to release the low back. The last exercises involve recruiting the glutes. There are a lot of exercises that might be appropriate, but one that I like is simple. It requires minimal equipment and it can really burn your glutes. Grab a stick and elevate your rear foot on a chair or a bench. Think about driving the weight into your heel and hinging backwards at the hip. Think butt out and torso lean forwards and bent. You want to keep your rear foot light and all the weight should be distributed onto the front heel. As you descend, the femur, or that thigh bone, works to glide backwards into the socket of the hip, effectively turning off the hip flexor and working the glute. Yes, this exercise will also work the quads, but the most activation should be felt at the glute. Perform until failure for 3 sets. So the bottom line is that pelvic posture influences pain through the low back pelvic floor chain, but evidence shows it's modifiable with targeted strengthening, not endless stretching if they aren't working for you. Keep in mind that pelvic pain is highly individualized, and there are people who experience it with no observable hyperlordosis or anterior pelvic tilting. The key is to find a routine that works for you and ideally see a men's pelvic floor physiotherapist in person. If you feel like you might benefit from pelvic floor stretching directly, check out this video I made a while ago for a 5-minute pelvic floor stretching routine. As always, drop a comment and let me know what you think, and I'd also love to hear your story. And if you like my content, hit that like button so we can keep showing this to men who might have similar challenges. Thanks for watching.